in the right atrium, left atrium. In the right atrium, you have several structures to see there, isn't it? The wall that divides the left from the right is a septum, and there is a depression which is a remnant of foramen ovale when it is already an adult and it closes, and that is fossa vasorum. Very good. And I already told you there is an opening coming from here over there, and that is what we call coronal ostium. Exactly. Now, there is a structure that divides the right atrium from the right ventricle, and that is what we call tricuspid valve. Exactly. As the name implies, tricuspid have three cusps. Okay, and tricuspid is one of the two valves which is called as a group as atrioventricular. That's correct. Now, the tricuspid valve has some fibrous attachments. We call it subvalvular structures. What are those? Or the tendineae and papillary muscles. Okay. The tricuspid has three cusps. So how many papillary muscles do you expect? Three also. Do you still remember what are the cusps?
Anterior, posterior,
And the one in septal, close to the septum. Okay. Now, when after the blood passes the ventricle has also several structures. Those ridges that you find inside the right ventricle are called what? Trabecular carne. There is one big structure, moderator band. Those corrugations are also found in the atria. What do you call those? Pectinate muscles. Okay, so you have trabecular carne in the ventricle, you have pectinate muscles in the atria. Now, when the ventricle contracts, the blood is pushed to outflow tract, and to the pulmonary valve. Pulmonary valve has how many cusps? Three. Do you still remember what are those? Anterior, exactly. Very good. All right. Now the blood will go to the pulmonary trunk, pulmonary artery to the lungs, and then will come back. When it comes back, it will be through pulmonary veins. Okay. The right superior and left superior pulmonary vein brings its blood to. Huh? I did not get you there. Huh? I was trying to see if I can catch it. It goes all to the left atrium. Okay. Now the left atrium, like the right atrium, several structures which I've already mentioned, and then there is a structure that divides the left atrium from the right ventricle, and that is mitral valve. Mitral valve is also known as bicuspid valve. Do you know why it's called mitral?
Looks like a crown.
The mitre of the Pope. Okay, two cusps. Okay, so do you still remember what are the names of the cusps? If you will forget all the cusp name, the only one that you should not forget is the mitral, because this is the valve that you will see in echocardiogram, and you will be able to identify which one is anterior, which one is the posterior. So, if your anterior, which is close to the septum, becomes hyperechogenic and not moving past, that means that valve is defective, it's sclerotic. Okay, and when it is sclerotic, it will not close fully. That means you have a situation called regurgitation. Very simple, huh? Yeah. Why? Because if it doesn't close, when it contracts, the valve will come back. All right. All right. So you have also ridges of muscle there, and they are called trabecular carne. Do you see moderator band in the left ventricle?
No.
There's not. Okay. So when the ventricle contracts, it will push the blood to aorta. Okay. Through what valve? Aortic valve. Aortic valve has how many? Cusp? 3 cusps. This one you have also to remember. Right and left and none. Okay. Why? Because when you see echo, you can also use that if you want. Non-coronary corpuscle. Because this, when you see an echocardiogram, you can easily identify what valve it is. And what is that sign?
Mercedes-Benz.
Mercedes-Benz sign or Mercedes sign, okay? Because it's really Mercedes, and you see it in echocardiogram. So these two, don't forget that one. Yeah, when they show you an echocardiogram and you say, oh, the moment you see the Mercedes sign, which is really Mercedes in echocardiogram, you can tell the cardiologist that's aortic valve, okay? And if you can identify that, you have a point of orientation already. Okay, so the heart will go